Pseudomonas aeruginosa is a very important bacteria which mainly causes hospital-acquired infections, right? So in this video, we will talk about general characteristics of this bacteria, important infections. We have an overview before diagnosis and treatment, and you will see why. Right, but the most important part is going to be this overview, because you can't go to class or go into an exam room without knowing that information on the slide which I'm going to show you, right? But don't skip anything, right? So let's start. First things first, I told you Pseudomonas aeruginosa is a very important causative agent of hospital-acquired infections, right? And in most cases they are gram negatives, right? So forgive my art, I'm not a good artist, but if you can see here, this is a patient lying on a bed, right? So this patient is connected to a lot of tubes, right? Okay, so firstly here you can see this one is just representing a ventilator. And if you look here, it's an IV, right? Intravenous lines. You can see here on the leg, let's just say it's a diabetic patient, right? She has a wound, or he, I don't know. Okay, and the last wire here is what a catheter, urinary catheter, Foley catheter, right? So the reason why I am showing you this is there is a way to remember hospital acquired gram negatives, like how they enter into a patient's body, right? So number one is through ventilator, and the disease usually through ventilator is pneumonia, right? Another way is through what catheters, right? A Foley catheter is UTI, and wounds, this will usually cause osteomyelitis, and wires IV, intravenous lines will usually cause bacterial sepsis, right? Okay, so you can see the 4 W's, right? So to remember like how they enter into the body, just to remember 4 W's, right? Wind for pneumonia, you can see it here, right? Wind for pneumonia, water for urinary tract infections, wounds, wires, intravenous lines, right? Okay, so let's go back to good stuff. Pseudomonas aeruginosa, right? I'm sure by now you remember this kind of classification, right? Is this algorithm is perfect for covering bacteriology in general, right? So this is a classification of what gram-negative bacilli, right? So according to fermentation, okay, let's just focus on Pseudomonas because I covered a lot of these bacteria. So please check our playlist. You'll see that we covered E. coli, Klebsiella, Salmonella, Shigella, Yersinia, right? So now we are covering Pseudomonas, right? So it doesn't ferment lactose and it's oxidase positive. That's all. Doesn't ferment lactose and it's oxidase positive. That's the only two things you need to know, at least for now. All right, so I said this bacteria is very important. Why? It's important for two reasons. Firstly, it colonizes and infects sick, immunocompromised, hospitalized patients. That's number one. Sick, immunocompromised, hospitalized patients. Number two, this bacteria is resistant to almost every antibiotic, so that it has become an art to remember things like what anti-pseudomonal coverage. Anti-pseudomonal coverage. Just remember this is very important. Antibiotic resistance. Pseudomonas aeruginosa is an obligate aerobe, non-lactose ferment, gram-negative rod. It produces a green fluorescent pigment called pyoverdin and a blue pigment called pyocyanin, which gives colonies and infected wound dressings a greenish blue coloration. It can also produce a sweet grape-like scent or a smell, right? So wound dressings and agar plates are often sniffed for organism identification, right? So you can actually smell like this fruity or grape-like scent, right, from the agar plates or from the bandages, right? Okay, so let's continue. Pseudomonas aeruginosa has a weak invasive ability, right? So that's why health people just don't get this infection with this bacteria. However, once inside a weakened patient, everything changes, right? What does it do exactly? It elaborates numerous exotoxin, including exotoxin A, which has the same mechanism of action as diphtheria toxin. Do you remember diphtheria toxin? Please click the link on the top right corner, or maybe later. For now, focus. Right. So, what does it do? This exotoxin A or elongation factor 2. Remember, it inhibits protein synthesis. Right. But these two, diphtheria toxin and exotoxin A, they are not antigenically identical. Can you say it? They are not antigenically identical. Cool. Some strains also possesses a capsule that is antiphagocytic and aids in adhesion to target cells, for example, in lungs. So there are about 9 important infections caused by this bacteria, right? Well, like, okay, 9, which I'm going to tell you in brief right now. Okay, let's start with the first one, pneumonia, right? So if you remember the W's, 4 W's, the first one is wind, pneumonia, right? Most cystic fibrosis patients have their lungs colonized with Pseudomonas aeruginosa. These patients develop a chronic pneumonia which progressively destroys their lungs. Immunocompromised patients, like those with cancer or those in intensive care unit, that's ICU, right, are highly susceptible to pneumonia caused by Pseudomonas aeruginosa. The second infection is osteomyelitis. I told you this one is related to what? To wounds, right? That's the second W. We just covered what? Wind. So now wounds. Diabetic patients have an increased risk of developing foot ulcers infected with Pseudomonas aeruginosa. The infection can penetrate into the bone, resulting in inflammation of the bone, osteomyelitis. Intravenous drug users have an increased risk of osteomyelitis of vertebrae or clavicle. Children can develop osteomyelitis secondary to puncture wounds to the foot. The classic example, right? Classic injury that leads to pseudomonal osteomyelitis is stepping on a nail while wearing tennis shoes. Remember, tennis shoes are often sweaty, and that will create a nice, moist environment for the water-loving Pseudomonas, right? So what's the term for water-loving? Hydrophilic. I don't know if you want to use that term, you can use it, but it's cool. It loves water. Okay. The second condition, not the second. I love number 2, guys. Okay, the third condition is burn wound infections. Burn wound infections. Still, we are on wounds, right? This organism sets up significant infections of burn wounds, which can eventually lead to fatal sepsis. Sepsis, again, is the next condition. Why? Right. Pseudomonas sepsis carries an extremely high mortality rate. This can come from infected wires, that's intravenous lines, or catheters, or from other sites of infection like wound, wind, water. Okay. The next infection is UTI, urinary tract infections, or pyelonephritis. This one is water. This occurs in debilitated patients in nursing homes and in hospitals. They often have urethral Foley catheters, which serves as a source of infection. The next condition is endocarditis, right? Very important. Staphylococcus aureus, Staph aureus, and Pseudomonas aeruginosa are frequent causes of right heart valve endocarditis in IV drug abusers, right? So, guys, you need to know this. In microbiology, there are a lot of bacteria, as you can see. It's been long since we started bacteriology, but we are still struggling because there are a lot, right? But bacteria like Staph aureus, Pseudomonas, these are very important, right? So you need to try by all means to remember at least. No, you should remember everything. I wanted to say 90%, but I just realized that if a patient falls in the other 10%, he or she will die. So 10% is still a lot, right? So you should try to remember everything. If you are enjoying this video, please give it a thumbs up, right? Right now, just give it a thumbs up so that we continue to the next, right? The next infection, malignant external otitis. So this is a pseudomonal external ear canal infection, right? So this infection will burrow into the mastoid bone, primarily in elderly diabetic patients. The next, corneal infection. This can occur in contact lens wearers or eye microtraumas, right? Okay, so this is just a picture showing someone wearing a contact lens. Last but not least, okay, this is the last one according to my list. Ecthyma gangrenosum. Right, so this is a rapidly progressive necrotic cutaneous lesion caused by Pseudomonas bacteremia. This is typically seen in immunocompromised patients, of course. Right, now it's time for an overview. Right, so firstly, general characteristics, right? So Pseudomonas aeruginosa, you can see the spelling aeruginosa, aerobic. So it's an aerobe. It is motile, catalase positive, gram-negative rod. It is a non-lactose fermenter, oxidase positive, and frequently found in water. It loves water, right? And it has a grape-like odor. This bacteria also produces PEEP, right? So PEEP is going to be a combination of virulence factors and a pigment. So let's see. So the first virulent factor is actually a phospholipase C. Phospholipase C is an enzyme that degrades the cell membranes. The next one, endotoxin. Endotoxin will be responsible for fever and shock. Exotoxin A inactivates elongation factor 2, and the pigments, if you remember the pigments, pyoverdin and pyocyanin, right? And it also produces reactive oxygen species like superoxide radical, that's O2 negative, and some hydroxide anions, etc. Those are very dangerous to proteins in enzymes, right? Okay. To remember, like everything, all the important infections which I talked about, you just need to remember the mnemonics, Pseudomonas. This one is very easy. Pseudomonas, right? So Pseudomonas for pneumonia, sepsis, ecthyma gangrenosum, UTIs, diabetes, osteomyelitis, mucoid polysaccharide capsule, otitis externa, the swimmer's ear, nosocomial infections like catheters or equipment like ventilators. Addiction, people who inject themselves with drugs like IV drug abusers. And skin infections as hot tub folliculitis, wound infection in burn victims. Right, one more time, because I want to tell you something here on mucoid polysaccharide capsule. Right, so one more time: pneumonia, sepsis, ecthyma gangrenosum, UTIs, diabetes, osteomyelitis, mucoid polysaccharide capsule. Right, so the mucoid polysaccharide capsule may contribute to chronic pneumonia in patients with cystic fibrosis due to biofilm formation. Right, moving forward, we have what? Swimmer's ear, that's otitis externa. Nosocomial infections, just hospital-acquired infections. Don't be confused. Right, so through catheters and equipments like ventilators, addiction, IV drug abusers, skin infections, for example, hot tub folliculitis, wound infection in burn victims, right? It also occurs in people with corneal ulcers or keratitis in contact lenses, contact lens wearers, or eye microtrauma or minor eye trauma. Okay, that's cool. Right, now let's talk about diagnosis and treatment. Right, so you know it's a gram negative, right? Gram staining, you can use all that, right? But what they commonly use, the method is cultural method. So using culture method, greenish metallic color appearing on colonies on blood agar which have a fruit grape smell, right? I told you can actually smell it in agar plates, right? What else? You can also smell, like, from the dressings, the bandages, right? You can also smell this fruit or grape smell, right? Okay, what about treatment? Firstly, before I tell you anything about treatment, remember Pseudomonas aeruginosa is known for what? For being resistant to a lot of antibiotics, right? Almost every antibiotic. Okay, so let's just talk about like the most commonly used one. So we can use anti-pseudomonal penicillins in combination with beta-lactamase inhibitors. For example, piperacillin or ticagrelin plus tazobactam. We can also use third and fourth generation cephalosporins, for example, ceftazidime or cefepime. We can use monobactams, fluoroquinolones, or carbapenems, right? But remember, it's mild drug resistant bacteria. Wow, thank you so much for sticking around. If you enjoyed this video, give it a thumbs up. And if you get the opportunity to donate at least even $1, I will highly appreciate that. If you check the comment section, you will see a link to my PayPal. There is another link in the description box, right? You can just click there and donate, right? Even $1 million. I am always saying $1, even 1 million. Okay, guys, see you around.